Today we're talking about, well, sleep and sleep hygiene. I never knew there was such a thing called sleep hygiene. Did you invent this, sort of, these words, this phrase, I suppose? Sleep hygiene.
No, I didn't, but it's funny because people do come into the surgery, obviously, thinking of oral hygiene, but we take the opportunity to not only check whether they're brushing and flossing, but we're also checking in on them about how they're sleeping. It's like tapping the hoop along, if you like, and we get to see our patients every 3 to 6 months, and so it's an opportunity to ask 3 fundamental questions. Is it easy for you to fall asleep? Or 4, actually. Is it easy for you to fall asleep at night? It should take about 20 minutes. Do you wake up through the night? I mean, if you just wake up and roll over and go back to sleep, that's different from waking up and going to the bathroom. Most importantly, do you wake up feeling refreshed? And also, do you wake up with a headache? And there are 3 or 4 fundamental questions. But sleep hygiene is really about building sleep into your day. And that's really what it refers to. I mean, it's all about how you approach sleep almost from the moment you wake up to the moment you go back to sleep again.
Why do you ask those questions?
Well, it gives us a clue as to whether there's a sleep problem.
Right.
And it kind of begins a conversation as almost like a consciousness-raising exercise between us and our patients to sort of elevate this to a point of importance, which it is. I mean, we've said this many times, Brent, that sleep is your built-in, non-negotiable life support system, and it's free. So why wouldn't you make the most of something that is not only accessible, not only cheap, but will actually impact on every aspect of your life, both in quantity and probably, both in quality, definitely, and probably in quantity as well.
How long have we been talking about the importance of sleep now? Now, when I say talking about it, I mean it seems that everyone's talking about the importance of sleep these days. But you go back, I don't know, how long? I was going to say go back a dozen years, and it seemed as though hardly anyone talked about the importance of sleep. Was it longer than a dozen years ago that we've been talking about the importance of sleep now?
Look, I think it's been a point of significant research, certainly for the last 15 or 20 years. And it just takes a little bit of time for that to filter to the profession, to various professionals. And then it's a personal thing as well, because many people have probably been to see their doctors and they may not have raised it as a particularly important part of their treatment. I'm often, for example, surprised at how many people are on antidepressants, but no one has really explored their quality and quantity of sleep. So if your practitioner in their own life does not prioritise it themselves, it's unlikely that they're going to raise it as a significant issue within their own practice. Because at the end of the day, practitioners are only human as well.
When you work a midnight to dawn shift on the radio, you get a lot of people that ring you and they say invariably they can't sleep. It seems to be at almost endemic levels.
It is. It is a significant problem. And, I think the statistics are like over 50% of the population or 60% of the population aren't getting enough sleep. And and as I've said as well, a consistently good night's sleep is a function of both quantity, getting enough, and quality, breathing well while you're asleep. So there's one thing to get enough to put your head on the pillow for the required 7 to 9 hours, say 8 hours on the average. But when you put your head on the pillow, you've also got to be breathing well while you're doing that. And I think there are now about 80 different sleep disordered breathing conditions, but the main one people will have heard of is snoring, and another one is obstructive sleep apnea.
Do you think that people's approach to sleep is serious enough?
Absolutely not, Brent. And top of my list of good sleep hygiene, and it is without a doubt the most important step people take, and that is to prioritise it. And we all get on the bandwagon at one point or another about something or other. But this is, I draw that analogy of tapping a hoop along the road. You've just got to keep tapping that hoop along throughout your life. You've got to play the long game, which hopefully is your life, and take it as a long-term view of it. Look, we all don't have good night's sleeps, and you can get so obsessed with this that it actually stresses you out so that you can't sleep. But if you take a step back from it, don't be too hard on yourself. Recognise that it's a really important part of your life. Okay, you didn't have a good sleep last night, but tonight we'll see how we go. And eventually, with good sleep hygiene, you will have a consistently good night's sleep.
How important is routine when it comes to good sleep hygiene?
It is fundamental. It is so fundamental. You know, Brent, when we had our daughter, and that was now 35 years ago, the paediatrician gave us what was probably the best bit of advice any health practitioner has ever given me throughout my entire life. And she said, you have to teach your child to sleep in the first year of life, and routine is the key. And that wasn't just advice for a newborn baby. That's why I rated it as probably the most important bit of advice I'd ever heard, because routine is the key. And there's something wonderful about routine. You see, there's this thing that comes up every morning called the sun and goes down every night, and it's been doing that for, who knows, billions and billions of years. And it is so important to us that we've kind of lost track of it because we've sidestepped routine, which used to be, we didn't have a choice. I mean, we went to sleep when the sun went down. For hundreds of thousands, if not millions of years, we went to sleep when the sun went down, and we woke up when it came up. And now we've kind of taken over control of that by our use of light. But routine is important for our body. There's a body clock we have inside ourselves, and the circadian rhythm of the body clock is a really important driver for sleep. So going to bed at a similar time every night and waking up at a similar time every morning is a really important part of the picture. Because if you've had a really lousy night's sleep and you think, I'm going to sleep until 10 o'clock, not a good idea in terms of good sleep hygiene and building a good routine.
How important is the atmospheric conditions of your bedroom to getting a good night's sleep?
Critically important. I mean, last week we talked about technology, but technology should be away from your head, at least 2 meters away, out of the room. You shouldn't be checking all your devices before you go to bed. So the environment in which you sleep is important. As well as that, it should be dark. It should be cool. The ideal sleeping temperature is around 18 degrees centigrade, a little bit cooler perhaps. So, you know, getting bedding and getting ourselves organised so that we can maintain a comfortable temperature is important. Noise is another factor. Actually, we'll get onto noise in a minute, but another thing that's often overlooked is dust mite and mold within the room, which causes all sorts of allergic responses, which makes it difficult for people to sleep soundly. So our bedroom environment, and listen, the other one is also, if you're spending 8 hours, a third of your life in bed, it is a fantastic investment to invest in good bedding and replacing pillows regularly, probably every 12 to 18 months, and putting the bedding out in the sun. Sun is one of the best killers of dust mite, and it's a cleanser and it's a wonderful thing. So bedding is really important. The environment in which we sleep is also critically important.
I read an article the other day. They said you should wash there's been research done, and people were asked, how often do you wash your bed sheets? And most people wash their bed sheets 3 or 4 times. Once every 3 or 4 weeks. I'll say that again. Most people in this research showed they wash their bed sheets once every 3 or 4 weeks. And it said you should really wash your bed sheets once a week, if not twice a week.
Yeah. Well, I mean, I think that's right. I absolutely think that's right. And I think you should wash those sheets in warm to hot water. And you should hang them out in the sun if you can, because we shed skin while we sleep, and that's why dust mites love feeding off our dead skin, and that's why dust mites are a part of our mattress where we sleep and where we have our bedding. So in our household, what we do is we wash our sheets every week in hot water and hang them out in the sun, and once a month we also vacuum the mattress once a month as well and turn it, and then vacuum it again with a HEPA filter, a very a high emissions particle filter that will collect the dust mites. So good hygiene in your bedroom, I mean, this is where you spend 8 hours a day, so you really need to be taking this part of it really seriously as well.
We're talking to Dr Ron Ehrlich. He wrote a book called Life Less Stress. We're talking about sleep hygiene. We're going to come back and talk about, do you have a drink before you go to bed? Is it alcohol? Is it coffee? Is it good or is it bad? We'll continue our chat next. We're talking this afternoon to Dr Ron Ehrlich. And Ron, I wanted to ask you this question. I know what you're going to say. What do they say? Never ask a question if you don't know what the answer's going to be. Talk to me about consuming alcohol or caffeine or even a cup of tea before you go to bed. I dare say you're going to tell us that that's not the thing to do.
Well, look, alcohol, it probably will make you go to sleep easier, but it definitely will not get you into the deeper levels of sleep that you need to have. And there are so many reasons we drink alcohol, and to anybody that's given it up for a week, a month, or a year, you will immediately become aware of how ubiquitous it is. It's just everywhere. You've had a hard day, you've had a good day, you've got a celebration, you've got a funeral, a birthday, a wedding, you name it, alcohol is there every single time. And I do enjoy a drink. In fact, I would describe myself as a social drinker, Brent, and my friends will tell you that there have been times in our lives when I've been too social.
Yes.
However, when it comes to sleep, let's not kid ourselves. Drinking too much, doesn't help sleep, and certainly drinking too much doesn't. So having a glass of wine at night with your meal, I don't think will greatly impact on sleep. It's just when you start putting away a half a bottle or a bottle of wine or a few beers, you put away a half a dozen beers and you kind of thought, that is definitely not going to help you sleep. And the flow-on effects as well, biochemically, is another whole story. So alcohol, put that one to bed, if you like. The other one is caffeine, and caffeine is a stimulant. And people having coffee in the morning. I also enjoy a coffee, Brent. I mean, this may surprise you, but I'm not perfect either. So I do enjoy a coffee in the morning. But I usually have my last coffee at around 9:30, 10 o'clock latest. I know it's said that by 12 o'clock you shouldn't have coffee after 12 or 1, because by 12 hours after you've had your last cup of coffee, there's at least a quarter of it still floating around in your body. So a cup of espresso coffee is about 150 milligrams of caffeine. So 12 hours later, you might have, I don't know, what's the maths on that, about 70 or somewhere between 40 and 70 milligrams of caffeine still floating around. And caffeine competes in our bodies with a really important driver of our sleep called adenosine, and it kind of competes with that. Adenosine builds up through the day, forces to go to sleep. It's kind of what's called the sleep pressure. And as adenosine builds, we get tired. And caffeine competes with adenosine. So, that's not a good thing either. And then tea has got about half the amount of caffeine. Of course, dark chocolate also has some caffeine in it. I love dark chocolate as well, Brent. So, look, it's all a balance. It's about balance here and timing. So I think, the reality is people are going to drink wine, or they're going to drink alcohol, and they're going to drink caffeine. But it's all about timing and moderation.
I got a couple of minutes left and I've got to go to the news. So let's talk quickly about noise and the position that you sleep, either on your back or your side. What's best?
Yeah, well, sleeping on your side, I think, is best. Sleeping on your stomach is a real problem for your head, neck, and jaw muscles, but also your airway. And it surprises me also over the years how many people have suffered from chronic head and neck pain, and no one's ever told them about their stomach sleeping position and how to overcome it. If you are that, it will take you 6 to 8 weeks to break that habit, but once you do, you'll never go back to it. Sleeping on your back is a problem for anybody who's getting a little older, and by that I mean anybody over the age of 30, 35. Your tongue is attached to your lower jaw, and so when you go to sleep, the muscles go really slack, and the lower jaw and tongue can drop back and block the airway and cause you to either snore which is a restriction of the airway, or actually completely block your breathing, which is what is called an apnea. So sleeping on your stomach, well supported, your legs well supported, your head well supported. If you looked at you from side on, the neck, the head, the neck and the pelvis would all be in a pretty good line, and that is actually a good way of sleeping from a neuromuscular perspective, but I think also it's good for a digestive perspective as well, and it's also good for an airway perspective.
Okay, that's sleeping on your side. I've run out of time. I've got to go to the news. I'll let you go. I'll catch up with you next Thursday at our usual time. Have a good week and sleep well, Dr. Ehrlich.
Always a pleasure, Brent. Bye.
Thanks, Ron. Bye-bye. That's Dr. Ron Ehrlich. As I said, he wrote himself a wonderful book. You can get a copy of it. I've got to ask him, can we have a couple to give away? It's called A Life Less Stressed. I'll get Kelly to do that, and we'll give a couple of those books away. It's a good read, it is.